So, what I'm going to talk about today is I'm going to just continue our series on just discussing a little bit about what is Chinese medicine. We've talked a lot about the uh, specific Chinese medicine diseases and treatments and a lot of herbs, but I wanted to just talk a little bit more on an overview of what is Chinese medicine. And last time I talked about um, the meridians as well as the pathways. We talked about qi and blood. And today I wanted to talk a little bit about the diagnoses. We also talked about the modalities of Chinese medicine. So this time I want to talk a little bit about diagnoses and the different ways that we diagnose in Chinese medicine. Now, the ways that we diagnose in Chinese medicine, it's partially a consequence of the history of Chinese medicine and how physiology was thought about and developed over time, and then in response to that, um, pathology and diagnoses. So, kind of probably one of the earlier forms of diagnosis methods was the 6 stages, and 6 stage theory really came out of Shang Han Lun in one of the earlier classical Chinese texts written around 200 AD, the Shanghan Lun. And this was from Dr. Zhang Zongjing. And he was the one who kind of characterized 6 stage disease. And 6 stage disease says that there are 6 different stages within the body that the qi and the meridians flow through, and disease can also progress in. And so there are names to each of the stages. The first stage is called Tai Yang, and then the second stage is called Yang Ming, then Shaoyang, then Taiyin, Shaoyin, and Jueyin. And in each of these stages, there's two organ systems that are typically associated with it. So, for example, in the Taiyang stage, there's the urinary bladder as well as the small intestine that's associated with it. And as the disease begins in each phase, it has different characteristics that are unique to that stage. And so, for example, typically Taiyang disease is considered the exterior, the most outer layer of the body, kind of the first layer of defense. And it's, like I said, it's associated with the urinary bladder, which tracks over the posterior part of your body, and it covers the widest breadth of the exterior of the body. And so when you have Taiyang disease, for example, this is when you might have chills, fevers, sweating, headaches, runny nose. And so that's an example of a Taiyang disease. And the disease changes every time. So then when it goes to the next level, for example, the Yang Ming, then you might have diarrhea or pain in the abdomen, hard, solid abdomen, high fevers, large sweating. Each disease level has its own disease characteristics associated with it. So you diagnose the pattern based on the symptoms, and then you connect it to one of the 6 stages. And then based on that, you can determine what the accurate treatment is. Now, within each 6 stage, it's further characterized into subcategories of diseases within each of the 6 stages. And so by the time you're done, there's dozens and dozens and dozens of different subcategories within each, within the whole ecosystem together. But that's kind of the first wave of pattern differentiation. Later on, when warm pathogen disease was developed, the Wenbing writers and thinkers used a different stage or called 4 stages or 4 levels. And in warm disease theory, they really categorized disease kind of by 4 specific stages. And they had, from the most superficial and exterior part of the body, it was called the Wei level. From the Wei level, then disease would enter into a slightly deeper level called the Qi level. Now, some of these terms have crossover with the sixth stage way of describing disease, but it has its own nuances, so it's not completely interchangeable. You have to still think of these in different ways. So typically, when we think of cold disease patterns, we think of them in a six-stage pattern. And when you talk about warm disease patterns, you can consider it in a four levels pattern. But in four levels, so you have the way level, which is the exterior, the surface of the body. Then you have the chi level, which is just below the surface. It's getting into the interior, but it's not considered fully interior yet. And then you come into the yin level, which is the third level. And the yin level is representative of now you're on the interior, and that's the nutritive level. And then finally, the deepest level of four stages is the shui level or the blood level. And that's the deepest level that heat pathogens go into. And so that's the four stages of disease that the Wenbing writers and thinkers had developed to categorize warm diseases. So that is its own ecosystem of classification. And then kind of in more modern thought, you have the 12 organ systems. And 12 organ systems it's similar to six stages in that there's um, the same organs that are part of the six stages. Like I said, each stage has two organ systems that are associated with it. The so you together have 12 organ systems. Now, each of those organ systems have specific functions and pathologies when they get messed up. They have different patterns of diseases and they have different ways of diagnosing it. They have different functions. And so 12 systems, 12 organ systems, really, I wouldn't say it's to do it properly, it shouldn't be like Western medicine. It shouldn't be a replica. Like when we say, for example, disease in the heart, you shouldn't necessarily think of the typical Western medical diagnoses of heart diseases. That would be conflagrating two different systems, but you should have some similarity present. Now, there are some organ systems, like for example, the spleen in Chinese medicine, which is not the spleen in Western medicine. They're completely two separate systems that probably have become accidentally named spleen because of historical translation issues. But some of the other organs, like the heart, the kidney, even the liver, the urinary bladder, there is some crossover, but we can't think of it in identical ways to Western medicine because it will improperly limit the scope of the organs that they are assigned in Chinese medicine, and you will miss out on a lot of signs, symptoms, and patterns if you think of it in a strictly limited Western medical view. The other problem, if you conflagrate the two systems, is that you'll misdiagnose. So, for example, if somebody comes with, let's say you have a patient that comes into the clinic and they say they have asthma. Now, in Chinese medicine, if you just think, okay, asthma, lung, let me treat the lung, you might be missing something else that's going on. They may have a large intestine problem, or they may have a urinary bladder problem, or some other organ system that's connected to the lung, not just the lung. So if you don't differentiate those two ideas in your mind, and when you kind of bring in a lot of baggage from the Western medical system, then you're going to impair your diagnosis abilities with Chinese medicine. So, but anyways, going back to 12 organs, that's probably a little bit more modern way of thinking about it, but it's very useful because it gives you a little bit more granular approach in categorizing diseases, because now we're thinking about diseases more to an organ level. And you're still considering the organ as part of a whole, and so you have to consider other organs that are related to it. But I guess you can now pinpoint it in a different way than you could with the 6 stages or the 4 levels. And so within each organ system, then you have to think about the characteristic diseases that affect it. So, for example, heart, you tend to have heart fire. That's a characteristic disease of the heart. You don't typically think of heart cold, although it's possible. And so each organ system can predispose to different types of disease patterns. And so you learn the organs and then you learn the subcategories of predispositions. And then you also just learn in general the other less common things that can happen to them. And so the 12 organ system is really a useful way. And I think it's probably an increasingly more common way of thinking about diseases, although especially for infectious types of problems, you still need to know 6 stages and 4 levels. They're both still incredibly important, especially when you're talking about cold diseases and warm diseases. And so, anyways, that's a little bit of an overview on how we think about diagnoses in Chinese medicine with the 6 stages, the 4 levels, the 12 organ systems. There's other ways to also think about diseases and treatments, but those are kind of the more well-known patterns. Okay, well, uh, that's a little bit about diagnoses in Chinese medicine, and we'll see you next time.